I am Dr. Muruganathan. I am a physician from Tirupur. I was the past President of the Association of Physicians of India, past Dean of ICP, past American College of Physicians Governor, and past President of Indian Medical Association and Tamil Nadu Medical Council. I am interested in hypertension. I am an hypertensionologist, and there is no such name hypertensionologist. I am introducing the name hypertensionologist. Thank you. Hypertension is a silent killer. In India, 1 in 3 people have hypertension, and the control rate in hypertension in India is less than 12%. The diagnosis of hypertension is very simple. The treatment is also simple, but still it's a paradox. The awareness and the control in India is not good. Why in India? Globally it is not good. That is why we want to make a noise about hypertension awareness, hypertension screening. Diabetes compared to hypertension is less prevalent. The morbidity and mortality and the prevalence of hypertension is 3 times more than the diabetes. But still, there are a lot of diabetic clinics, diabetologists, but unfortunately, we don't have hypertension clinics and hypertensionologists. And also we don't have a hypertension registry. And we must have a hypertension focused clinics. You know, in a diabetic clinic, the physician, the diabetologist focus only on diabetes, whereas hypertension is treated by general physician, cardiologist, nephrologist, everyone. So nobody wants to take that hypertension as their specialty. So that is why my idea is to promote hypertension clinics all over India. So that's the talk I gave, the need for hypertension clinics in India. As I said, the hypertension causes, it's a hemodynamic malignancy. It causes more heart attacks, it causes cerebral problems, paralysis, eye problem, nephrologic problem, then kidney failure, epistaxis. So many complications are there. So only when you control hypertension, you can prevent all complications. Even the recent COVID, if you see, the people with hypertension, that to uncontrolled hypertension, the morbidity is more. So the key is hypertension control. When you say hypertension control, we start with the lifestyle modification and with the drugs. We have got simplified protocols. We got enough drugs to control hypertension. But unfortunately, people do not understand it is a lifelong treatment. And people do not understand lifestyle modification. They take salt, they don't take vegetables, fruits. So all these things, we must focus. The purpose of the hypertension clinic is to focus and give them in the regional language what is hypertension. Suppose if we don't prevent or control, what will happen? These things we must always tell the patients in regional language. You should do a counseling. You should do what type of exercise you should do, what type of diet you should take, and also the drugs regularly you should take. And you must adapt a village. Nowadays, telemedicine is so good. Each clinic, each center should adapt a village. And another concept is hypertension center of excellence. You see, when somebody has got hypertension complication or when they have secondary hypertension, we must have hypertension center of excellence where under one roof the neurologist, the cardiologist, the nephrologist, endocrinologist, everybody is there. So when somebody comes with hypertension complication, that can be treated effectively. Also, they can diagnose secondary hypertension with the state-of-the-art lab. So that is the hypertension center of excellence. When a physician with 5 years of experience on hypertension, they can start an hypertension clinic. They should have a registry, they should have a minimum ECG machine, ophthalmoscope, echo optional, and they should have a paramedical and medical people who can talk to the patients and advise about the awareness and about the control. So this is what I want. So home blood pressure monitoring is not popular compared to home blood sugar monitoring. So that also you have to promote home blood pressure monitoring. By doing all these things, we can control hypertension. The economic burden of the country, the health burden of the country, health burden of the world can be controlled if we control the hypertension. We seek all your support, all the stakeholders to support us to start a hypertension clinic, focus on hypertension clinic, create an awareness, control hypertension. And even the Bhagavad Gita says somebody who's got calm mind and with a little more meditation, with little more understanding, they can control hypertension, not only hypertension, all lifestyle diseases. Thank you very much for your patient hearing. Namaste.